Have you ever found yourself repeating what you said because others just did not quite hear you? Or perhaps you have noticed your own voice sounding a little different lately, maybe a bit softer or less expressive than usual. These subtle shifts in how we communicate can sometimes feel minor, yet they might hold important clues about our health. Indeed, voice problems, particularly a softening of the voice, can be an early and often overlooked sign of Parkinson's disease. This change, medically known as hypophonia, means that the volume and intensity of a person's voice decrease, making it harder to be heard, even in quiet settings. It is a symptom that can begin very gradually, often before other more well-known motor symptoms appear. The reason these vocal changes occur is directly linked to how Parkinson's disease affects the brain. Parkinson's primarily impacts the neurons in a specific part of the brain called the substantia nigra. These neurons produce dopamine, a crucial chemical messenger responsible for smooth and coordinated muscle movements throughout the body. When dopamine levels drop, it affects all muscles, including those involved in speech production. Your vocal cords, larynx, and even the muscles you use for breathing become less coordinated and more rigid. This leads to reduced vocal cord vibration, less force in exhaling air to produce sound, and a general weakening of the entire speech mechanism. Consequently, the voice becomes quieter, often sounding monotonous or sometimes even hoarse. This progressive loss of vocal power is a direct reflection of the underlying neurological changes. If you or someone close to you notices these kinds of persistent voice changes, the first step is always to consult a doctor. They can evaluate your symptoms and determine if they are related to Parkinson's or another condition. While awaiting a diagnosis or as part of a management plan, simple voice exercises can be beneficial. Speech-language pathologists can teach specific techniques to help strengthen vocal muscles, improve breath support, and enhance voice projection. Even being more mindful of speaking loudly and clearly can make a difference in daily interactions. Interestingly, these voice changes often appear alongside another subtle but related early sign of Parkinson's called hypomimia, which refers to reduced facial expressions. Just as the muscles for speech become less dynamic, so too do the muscles of the face, leading to what is sometimes described as a masked face. Both symptoms stem from the same underlying issue of impaired muscle control and reduced automatic movements. Recognizing this connection can provide a more comprehensive understanding of early Parkinson's indicators. Understanding that softer speech is not just a minor annoyance but a potential early signal of Parkinson's disease is incredibly empowering. It highlights the importance of paying attention to even the most subtle changes in your body or the bodies of your loved ones. Early recognition and diagnosis of Parkinson's mean that management strategies, including therapies and lifestyle adjustments, can begin sooner. This proactive approach helps to maintain communication abilities, improve overall quality of life, and navigate the journey with greater confidence and support.